Welcome to the COVID-19 Genomic Epidemiology Toolkit from CDC's Office of Advanced Molecular Detection. My name is Greg Armstrong, and I will introduce our topic, using genomics to investigate the epidemiology of COVID-19. Then I'll explain why we developed this toolkit, what it contains, and who should use it. Finally, I'll preview the other modules in this toolkit, which have been designed to help you start using genomic sequence data to supplement your epidemiologic investigations. There's been an explosion of interest in the past decade in the application of microbial genomics to public health. The widespread use of genomics in recent years was made possible by a technological revolution that took place in the early 2000s. The ability to sequence the DNA of microbes has been around since the 1970s, but for 3 decades was dominated by a single method, known as Sanger sequencing, which was itself advancing at a fairly fast pace. Starting in 2005, however, a new group of technologies, collectively known as next-generation sequencing, began to enter into use. These technologies have completely transformed what is possible to do with genomic sequencing. It's now possible to sequence many thousands of times as much DNA or RNA as was previously possible. You may also hear the terms high-throughput sequencing or whole genome sequencing. These terms are often used interchangeably with next-generation sequencing. At the time of this recording, in late 2020, microbial genomics are widely used in the US public health system. In food safety, for example, sequencing technology has replaced pulse field gel electrophoresis, or PFGE, in the National PulseNet system. With respect to antimicrobial resistance, high-throughput sequencing can be used to infer resistance and to better understand the dynamics of transmission. For influenza, sequencing is now a core part of national strain surveillance, playing an important role in informing decisions about vaccine strain selection. In the tuberculosis world, sequencing has replaced older, lower resolution technologies for identifying and investigating transmission clusters. For Group A strep, it is used to investigate outbreaks in healthcare settings. For malaria, it provides a practical tool for monitoring resistance and other important traits, such as mutations that can reduce the effectiveness of rapid diagnostics. For rabies, sequence variants are often used to track transmission between geographically distinct populations. High-throughput sequencing is now in use in some manner in almost all areas of infectious disease public health in the United States. Genomic technology has been widely adopted by US public health departments. As of last year, all state public health laboratories have high-throughput sequencing capacity. All are using it for foodborne disease surveillance, and many are also using it for an increasing variety of applications. Which brings us to COVID-19 and the virus that causes it, SARS-CoV-2. In the next few slides, I will review the rationale for applying sequencing technology to this virus. From a very broad perspective, it's useful to look at this rationale at 2 levels. At the national level, sequencing of the virus is a core part of strain surveillance, which looks for trends that could have implications in diagnostics, vaccines, or therapeutics. At the state and local levels, genomic data can supplement control efforts and provide a more granular picture of the local epidemiology. The next few slides will describe these applications in a bit more detail. At the national level, sequencing plays an important role in monitoring the emergence of important new strains and in monitoring trends after interventions such as vaccination. These data will be important in supplementing epidemiologic and clinical findings. This national surveillance is managed by CDC with support from state and local health departments. Genomic data are made publicly available in real time so that researchers in academia and in the private sector can analyze them as well. At the state and local level, sequencing is also useful and can have an even more immediate impact. In fact, it is because of this potential for local investigation and control efforts that CDC has developed this toolkit. One application of sequencing is identifying clusters of COVID-19, as highlighted in this study from one region of the United Kingdom, where routine sequencing of SARS-CoV-2 unexpectedly uncovered a sustained outbreak in 6 healthcare facilities. Another application is investigating clusters, as illustrated in an MMWR article. In this report, the Minnesota Department of Health described investigations of outbreaks in 2 skilled nursing facilities. In each of these, genomic data strongly suggested that the outbreak was caused by a single introduction of virus into the facility, which then spread among its residents and staff. These findings strengthen the push to improve infection control, or IPC, practices in these 2 facilities. The findings from these investigations will be presented in more detail in a later module in this toolkit. Genomic data can also add granularity to and improve the understanding of local epidemiology, as highlighted in this study, which looks at the genomics of early SARS-CoV-2 infections in the Boston area. One of the interesting insights here is around a super spreading event tied to an international conference that took place in Boston. The genomic data provided further evidence that super spreading had occurred, but in addition was able to show how virus from that event had spread locally, including to and among individuals experiencing homelessness, and then throughout the United States and even internationally. The paper also describes investigations of 2 subsequent outbreaks in a Boston acute care facility. In both cases, in contrast to what was described in the previous slide, genomics showed that the viruses involved were not closely related. This was evidence that the cases most likely came from spread in the community and that IPC practices had been effective in stopping transmission within the facility. Genomics has many other applications in the prevention and control of COVID-19. For example, this paper from the Nevada Public Health Laboratory describes how genomics was used to confirm a case of reinfection by showing that the viruses causing the 2 illnesses were genetically distinct. In this investigation, the authors went a step further. By working with the state forensics laboratory, they were able to confirm that both specimens were from the same individual, thus ruling out the possibility of specimen mislabeling. We have designed this toolkit to help epidemiologists at the state and local levels to respond to COVID-19. Although targeted to epidemiologists working in infectious disease programs, the toolkit may also be of use to laboratory scientists, bioinformaticians, and public health administrators. We're including additional resources to encourage the broader application of genomic epidemiology in controlling the spread of SARS-CoV-2. We are building the toolkit in a modular fashion, trying to keep the modules as small and as self-contained as possible, so that epidemiologists can choose to use the modules most relevant to their work. Over the next few weeks, we will be releasing additional modules in 3 categories. Part 1 introduces basic concepts in genomic epidemiology and in the genomics of SARS-CoV-2. Part 2 contains case studies demonstrating specific uses of genomics in response to COVID-19. Part 3 discusses some key tools and skills for analyzing genomic data and integrating it with epidemiologic or clinical data on COVID-19. This toolkit is the product of a collaboration with several groups, and we'd like to take a moment to thank the Translational Genomics Research Institute, or TGen North, and in particular, Haley Yaglom. We'd also like to thank the Minnesota Department of Health, particularly Nick Leonards, Ruth Linfield, and Sean Wang. And here at CDC, the following individuals have taken charge of producing this toolkit: Nancy Chow, Lusanne Draper, Marta Gwynn, Shatavia Morrison, and Michael Wiegand. The COVID-19 Genomic Epidemiology Toolkit team plans to add more modules and materials regularly. So please check back for updates, or better yet, subscribe to our mailing list from the CDC Genomic Epidemiology Toolkit page. Thank you.